Okay, so I am going to be talking about hunger and food poverty from a children's social care perspective. I can only really speak to the child protection system because that's the one that I've been working in. And obviously, that is quite specific when we're thinking about the public sector. So just briefly about me, I'm so pleased that Liz is here. I just want to say a massive thank you. Your course was incredible at Warwick and really, really inspired me to continue my interest and kind of passion in this field, despite, moving into social work. So I worked in local authority services since 2016. And even though I'm now working internationally, I still work on the front line with families and children every day. So obviously the context here now is incredibly different to what I was working with in the northeast of England and in London. But yes, it's always conversations around food are always sort of in the back of my mind. And I think that's probably, I've just put at the end there about my passion for permaculture, because I don't think I can have these conversations without talking about permaculture, because I really do feel like growing food communities is a big part of the solution to what we're talking about today. So thinking about values and thinking about individual values within social work was quite interesting, actually, because the first thing that came to my mind was that all social workers have to uphold particular professional standards to continue working as a social worker. So in some ways, the values are almost set from, a kind of policy perspective. And the values are great. The standards are great. They're about promoting rights, strengths, well-being of people. They're about trust. They're about ethical practice. They're about being held accountable. But of course, within that, when we're thinking about human-centered work, we're thinking about the public sector, we're thinking about what we bring as practitioners to our work with families, there is always going to be individual values. And I know, Ed, you were talking about that at the beginning. And values differ greatly across social workers. And I think it's a really interesting paradigm to look through food when we're thinking about practitioners' values when it comes to working with families. It leads me on to thinking about child protection and how it's unfortunately become across the country a bit of a blue light service rather than a preventative service. And when I was thinking about the conversations that we'd be having today, I was thinking about how actually food is never really talked about. And when you have the pressure of thinking about child safety and risk and ensuring that a child is safe, food is unfortunately at the bottom. And it becomes sort of a tick box if that child is eaten today. And unless there's a referred concern specifically about, malnourishment or obesity, generally social workers are not having conversations, as far as I know, with families about food. And we also need to think about the context that social workers are working in at the moment. We're under-resourced, particularly in the child protection sphere. Social workers are facing secondary trauma every day. It's an incredibly difficult space to work in. And so trying to do anything sort of maybe a bit more outside of the box, which I know it shouldn't be, but that's how that's how things kind of develop. It becomes nearly impossible. I've just noted there that I think that conversations around food could be like an invitation of humanity, and I think that they are. And I'll go on later to talk about times where it's much easier to have those conversations with families. And I do believe that having conversations, it's an intimate thing, what you put into your body, what you like to share, how you like your food cooked, what's important to you, the stories that come with food. the meaning behind food, it can be a really lovely and sensitive topic to talk about in a human way. But unfortunately, the child protection system, as it is at the moment, can feel very punitive, and there's often not space for those conversations. And that's what leads me to thinking about state intervention versus private family life. And as I mentioned about child protection services sometimes feeling punitive, and as much as practitioners want to kind of allay some of that difficulty for families, it's a really, really difficult space to be in. And when I was thinking about this, I was curious about whether practitioners would feel comfortable even having that conversation, because often that dynamic of when you're going into a family and they're at total crisis point, you know, maybe it would feel too intrusive to have that conversation about food. And you almost want to give some power to the family to say, you know, you eat what you want, you cook what you want, you know, I'm not gonna speak to you about that area of your life. Like, there's parts of our assessment that we're not going to go into. And that's not, again, it's individual values. That's not every social worker, it's not every practitioner. But it's interesting to think about how these values can play out in very different ways. I was also thinking and curious about practitioner values changing once a child is open to child protection services, and how everything kind of steps up a level. And I think the way that practitioners then work with families does shift, because child safeguarding is seen as the most important, and, you know, it's put on a pedestal. But it means that people can, unfortunately, again, this is not everyone, and again, this is a system issue, not an individual issue, but it can become a bit like policing, and it can feel really, really uncomfortable. So I wanted to give an example of, it was a Vietnamese family, interestingly, since I'm in Vietnam. There was a big Vietnamese community in the borough that I worked in just before I moved to Vietnam. And I was working in a no recourse to public funds team, which I'm going to talk about in a little bit. So I think Emma had mentioned that briefly, and Ed as well, about families who their immigration status means that they're not allowed to access state support, but they can access support from the local authority if they have children. So I was on a joint home visit to a Vietnamese family. Their child was on a child in need plan because they were facing destitution. So we were providing housing, money, and legal advice. And the health visitor was quite sort of transfixed on this idea that the baby was underweight. Now, the family were very slender. To me, it seemed quite normal that the baby was going to be slightly slimmer. I didn't see, you know, there was no issues in the way that the parents were feeding the child, and they were feeding the child Vietnamese food. And the way that the health visitor questioned and the advice that the health visitor was giving to the family felt like it was from a very clear child protection lens, rather than thinking about her own values, the values of the family, the values of the system, and the impact that those conversations can have when you've got such a vulnerable family who are so reliant on services, and then, you know, they're trying their best to sort of firstly understand the system and how it all works, because English is not their first language, and actually they didn't really speak any English at all. So everything is already incredibly challenging for them. And then it felt, you know, as I watched the interaction, that there was a lack of understanding about why this health visitor was insistent that they gave their child dairy. And I think that's just a really interesting point to highlight how many different values are kind of at play there, and how you can use that invitation of humanity in talking about food in a really culturally sensitive way and in a really inviting and lovely way, and ask them, you know, what did you eat as a child and what made you feel good and all of that kind of stuff. And again, just briefly about the postcode lottery that I mentioned earlier. I haven't worked in a borough where there's been a big focus on food and nutrition. I've definitely been around conversations when there's different schemes or there's like a charity who are promoting particular work and they want to work with the local authority or something like that. It's just very dependent on where you are, where the money is. Maybe the team manager has a particular interest, but it's very, very postcode lottery in terms of the focus on food and nutrition for children in the child protection system. So I want to talk about the No Recourse to Public Funds team that I worked in and the early help project that I was working on just before I left, because I think it's a really good example of how these conversations can work really well in the public sector. And it really speaks to how much space there can be within an early help setting rather than in a statutory setting. So as we talked about earlier, I really, really liked Emma's definition of destitution, because the families that we worked with, it was certainly not just about food poverty. These were families who, to access state support, needed to reach an incredibly high threshold, and they had to prove that they were homeless and that they literally had nothing in order to get some support from the local authority. So I was really lucky that I was working in that borough at the time where we got some funding to start a pilot project, and it was about supporting families who have no recourse to public funds, but from an early help model. So instead of putting out the fire and kind of they have to meet that really high threshold and then we provide support, we provide the support early on. So we worked really closely with health visitors, midwives, local community centres, anybody who had access to families who maybe who had no recourse to public funds. And it was fantastic. It was really innovative. It was creative. We worked in a multidisciplinary team, which I know, Ed, you mentioned before about how important they are, and I can't stress that enough. I think the best work that I've ever done and the work that's felt the most impactful has always been in a multidisciplinary team. So the project was myself, a worker from Shelton and a worker from Lewisham Refugee and Migrant Network. So we were able to provide social work intervention, housing support, and legal advice around immigration. And we were able to just say, okay, we've got some cash, what do you need? We would speak to the families and say, you know, what do you need right now? So for example, I had a family that Eid celebrations were coming up and they wanted to buy some presents for their children. And I was like, great, okay, that's a justification that's going to improve quality of that child's life. Then we can give you £100. And we had a lot of room to work with, you know, seeing what worked, how the money should be spent, and how the project would run best. And it was evaluated at the time. I think it was the Global Centre for Excellence, or I'm not sure. But they were evaluating it at the same time that we were running it. And it came out, you know, all of the research showed that it works and that it was necessary. So it was a fantastic thing to be a part of. And I think just shows that we could have really meaningful conversations around destitution and around food poverty because we had the space and time to do it, you know. And of course, it's a very different setting than in child protection, where actually you're trying to do 101 things at once and you're worried about children's safety. Actually, when we were working from an early help model and we were able to kind of work with grassroots organisations, and we were much more on the ground rather than in the confines of statutory services. And we could see a need and we could meet it. And we had loads of conversations around food because the way that we organised, the type of questions that we asked, and when families first came to us, we had a big focus on food, because we know how important it is for families facing destitution. So it was really powerful, and yeah, I feel like I can't recommend that way of working enough. Just to the final slide that I wanted to talk about was about our connection or disconnection to food. And these are simply my observations. This is not research, this is not evidence, this is simply my observations of working with families for the last 7 or so years. And it's been really interesting starting off my social work journey working with white British families in the northeast of England, to such a diverse range of families in London, working with lots of migrant communities. And when I was thinking about that and thinking about food, I was thinking about how so many of the communities that I worked with in London, who had migrated to London and were very much connected to their home countries, to traditional foods, were much more able to meet their family's nutritional needs. So the food was much more likely to be whole foods, and it's much more able to kind of track from farm to table, compared to families that I worked with in the northeast of England, when there was a huge reliance on ultra processed foods for all of the reasons that we've just talked about, and how the nutritional content of that food was generally a lot lower than the food that I saw being prepared and given to families from certain migrant communities that I worked with in London. So it's just fascinating that the way that practitioners think about these things and whether they have conversations about these things. And generally you won't, when you're overworked and you're under-resourced and you don't need to have those conversations, you generally don't. And I was also just what I've written at the end there about, there'll be so many social work practitioners in the UK that are probably eating ultra processed foods because that's so part of the British diet at the moment. So why would there even be a discussion in the first place? And all of this I think is just absolutely fascinating. And when we think about the context of our globalized food system and the crisis of our globalized food system, and the impact that it's having on individual children's health. So that's actually probably my concluding thoughts. If anybody has any questions, comments, then yes, I'm more than happy to discuss.